Bruxism is the involuntary habit of grinding or clenching the teeth, usually during sleep. It can cause jaw pain, tooth wear, headaches, and sleep disturbances. To treat bruxism, the use of nighttime dental splints that protect the teeth is recommended. In addition, relaxation techniques, physical therapy, and medication can help reduce stress and muscle tension. It is important to consult a dentist for a proper diagnosis and personalized treatment, as untreated bruxism can cause serious dental and health problems.